Well, good morning, everyone. Good morning. Good morning. Welcome. Thank you so much for coming to our session. I know there were a lot of really good ones that are being offered right now, and so we are so grateful that you chose to be here with us, and it's going to be a very interactive and informative time. My name is Brandy Yee. I'm the Chief Program Officer at Act for Alexandria. We're the community foundation in Alexandria. And we want to thank the Bainham Family Foundation for sponsoring this session. Also for our planning committee members who helped to plan this awesome session for you all. Today is a deep dive session. We're going to talk about getting into advocacy as foundations and funders. And over the next hour, you're going to hear from Abby Levine and Brian Marroquin. We'll also have time for Q&A. And then we're going to have a discussion among your tables with your peers. So you've got some questions. And I know we're on a kind of a limited time because we're running behind on some things. But I'm really thrilled to be part of this session and to introduce you to two colleagues, but who also happen to be friends. I met Abby, I think about 15 years ago, when she served on the board of a small nonprofit called Friends of Guest House, works with women coming back from incarceration. She also has done many trainings to Alexandria nonprofits on the role of advocacy. And she also worked with our board, and she did some work with the Boulder Advocacy Program at the Alliance for Justice. She recently joined the philanthropic sector, and she is working as the Associate General Counsel and Senior Policy Counsel at the Robert Wood Johnson Foundation. She's excited to share how foundations can build and strengthen their advocacy capacity to achieve their missions. Brian is the Director of Grants and Initiatives at the Arlington Community Foundation, and he and I met last year for the first time, and it's been wonderful to have a colleague who is just right next door in Arlington. Brian is also newer to philanthropy, but he has an extensive background in nonprofits and elevating underrepresented voices. He was still is, a National Urban Fellow, or involved with the group, and a director at Lyft. He was also an AmeriCorps volunteer. As a first-generation immigrant from Guatemala, he developed his advocacy skills early on as he helped his family navigate systems of support. So he's going to share an example of a case study that talks about developing capacity and alignment with other stakeholders using guaranteed income pilot programs that they have in Arlington. So we were going to hear from Abby, we'll hear from Brian, and then we'll take some questions, and then we'll have time for discussion at your tables.
Global news and really about the deep divides in our country. But that also shows why advocacy is so important. And no matter what issues your foundation focuses on, no matter what part of the Commonwealth you are in, what regions you focus on, it really just shows why advocacy, why speaking up, why getting people in the community talking about the issues that they care about is really so important. So I know everybody really wants some PowerPoint on a Wednesday morning for your lunch. So I'm going to show a few very brief slides. This is sort of done as a deep dive, but this is sort of a shallow swim in the pool. We don't have nearly as much time. I can spend hours, days talking about this. I promise I will not. But if anybody wants, we're looking forward to the discussion, and then my email is on the slide, and I'm always happy to talk with any of you in as much detail as you want. I can really nerd out on this. It makes me really fun friends. So hopefully this works. But what we really want to do today is really talk about the power of advocacy, and in many cases really demystifying what advocacy is. Advocacy is a really powerful tool in your advocacy, or in your philanthropic toolbox. As we know, there are a lot of different tools in terms of grant making, in terms of leadership ability. I was in the session yesterday learning more about impact investing. There are a lot of different ways that our foundations, our philanthropies, can have a power in our community. And advocacy is one of those strategies. I will say, we don't do advocacy just to do advocacy. There's often, as much as I'm an advocate for advocacy and say, it's so important, we don't do it just to do it. It's a way to accomplish your mission. It's a way to fulfill the value, to carry out the values, and to live the values of your foundation. So it all comes back to mission. It all comes back to what are you trying to accomplish. And most of the time, advocacy is a useful tool, and sometimes the most useful tool to do that. But I will also say it's not always the right tool. Direct support is really important, and there is a time and place for giving for food and for education and for counseling services and medical care. And again, too often I think in our sector we get bogged down in, well, should we fund advocacy or should we fund direct support? And it's really not an either or, it's a both. But and some of the most effective, usually the most effective advocates are people who are providing or benefiting from the services that are being provided. They know what works and most importantly, what doesn't work. And they are really useful advocates. So again, we need to move away from this often false dichotomy of, are we going to do advocacy or are we going to do services? It's really important to do both and to think about that in some way it really is a continuum of how do we change lives in our communities. And I think for all of us, no matter what your issue is, and many of the organizations that you support, in many ways we want these organizations to go out of business. Not because they can't sustain themselves, not because they can't get staffing, but because their services are no longer needed. I think food banks that's not the ideal way that people should eat. Homeless shelters, not the way that people want to be housed. And so thinking about what we're doing, thinking about advocacy is a way to change that system. Now, when we think about advocacy, it too is a really big umbrella. Or I'm sticking with my advocacy toolbox because I couldn't find a good graphic of an umbrella. My graphic skills are limited. But advocacy is a broad array of strategies and tactics. Yes, lobbying, we all hear about that L word and often go, or we hear about politics and go, Yes, those are types of advocacy, but they are only two of the many types of advocacy that are in our advocacy toolbox. Many of the tools of what I would call advocacy, you may already be doing and not thinking of as advocacy. And that's okay. It's more important to do it than to say, I'm doing advocacy. So I would argue that storytelling about the issues and the concerns and the divisiveness and the needs in your community is a type of advocacy. Convening, bringing people to the table to talk about the issues is a type of advocacy. Research, polling is a type of advocacy. Relationship building, whether it's you with other funders, whether it's you with partners in the community, whether you with government entities, is a type of advocacy. Essentially, advocacy is a way to talk about public policy issues, talking about issues that government decides, that government's involved with. And sometimes it may be sort of taking what government is doing or has done and sharing that information with the community. And sometimes it's going to the community, finding out what the community wants or doesn't want, and bringing that up to policymakers. Both are really important. Just thinking about in the world of healthcare, where I'm now really immersed, thinking about the Affordable Care Act. There was so much advocacy and even lobbying, and yes, even political activity to get the Affordable Care Act passed. And there were people arguing on all sides, many sides, for what they wanted. But once the bill was passed, there was so much confusion. And again, there was so much misinformation about what it actually did that one important advocacy strategy was for organizations, foundations, and grantee organizations to inform the community and to have information sessions about what it offered to people and what wasn't involved. There were no death panels. Government wasn't going to decide whether grandma lived or died. And so sharing that information is a really important type of advocacy. There are some types of advocacy that are more limited for philanthropy. So most probably, whether you're a private foundation, a community foundation, we as a 501c3 organization, we cannot support or oppose candidates for public office. So we cannot tell people which candidates are better at the federal, state, local level. We can't imply who people should vote for. We can't give money to candidates. That doesn't mean, however, we can't be involved in election-related activity in terms of making sure people know about voting, making sure people have the tools to vote, making sure the system is fair and who can vote. And there are a lot of ways that we can get involved in election season that's short of supporting or opposing candidates or political parties. Then we get to that L word, lobbying. Private foundations are much more limited in lobbying. That is true. As a private foundation, private foundations cannot spend money on lobbying. But again, we still can engage in and fund all of these other types of advocacy activities. And for those of you in the room who are with public charities, with community foundations, you actually can lobby. And so there's a lot more that you can do. And again, I can spend lots more time talking about this, but in the interest of time, I really want to focus on 4 key points. The first, as I've already said, is that advocacy and lobbying are not synonymous. Lobbying is a type of advocacy, but advocacy includes a lot more. So it's really important when you're talking within your foundation, whether you're talking amongst the staff, whether you're talking with boards, with grantees, that you're all using the same definitions. These words are often used a lot: advocacy, lobbying, and politics, political. And people come to that with very different meanings, with very different definitions. It's less important about what term they're using, but to really dive down into what that means. And I can say now, as being in the general counsel's office at a foundation where I review proposals, sometimes it's really hard to figure out, what do they actually mean by this? Are they lobbying? Is it not lobbying? And so it's really important to look at what the activities are. As I mentioned, private foundations cannot lobby. We cannot lobby ourselves. We cannot make grants specifically for lobbying. But public charities, public foundations, community foundations can lobby. And you can use either the 501h expenditure test or the insubstantial part test to determine how much lobbying you can do, but in many cases it's probably a lot more than you think. Even though private foundations cannot lobby ourselves, and even though we cannot make grants explicitly for lobbying, we can still fund grantees that lobby. We can make general support grants to organizations, to public charities that we may know are lobbying, and that's okay. So there's a lot of ways we can make grants that provide a lot of flexibility to our grantees. And then finally, issues may be controversial and political, and these days it seems like every issue is controversial and political. That doesn't mean, however, that they are partisan and out of reach for us. We need to be mindful of how we're talking about them, but oftentimes people say, oh, well, we don't want to talk about reproductive care, or we don't want to talk about climate because that's partisan. And yes, that's true, and it means we need to be thoughtful about how we talk about it, but it doesn't mean the issues are automatically off the table. Finally, when we think about advocacy, there is no one right way for foundations to engage in advocacy. Every foundation is different. Your missions are different, your board composition, culture is different, your staffing is different. I'm lucky I'm at a foundation with a law department and a policy department. Some of you may be at foundations that have no staff at all, and you're thinking about how do we do this. There is no one right way, and there's no best way. In fact, the best way is what works for your foundation at this time, and recognizing that may change, and it probably will change. And it'll also probably change depending on the issue. Again, sort of a spectrum that I created many, many years ago when I was at Voter Advocacy, and that's in Voter Advocacy's Philanthropy Advocacy Playbook, sort of looks at the spectrum from capacity building at one end to lobbying at the other end. And recognizing that some of what we may do as funders is to provide the resources and the tools to our grantees so they can advocate or lobby if they think necessary. And we're sort of agnostically providing the tools for them to do that. On the other end of the spectrum for community foundations is to lobby for particular bills and particular resolutions or ballot measures. In between that, there's a lot of other things in terms of talking about issues that we care about, meeting with public officials, convening groups. And this is, while on paper it's a linear structure, it's really a revolving, waving, and sometimes you may be advocating for a particular issue. Other times you may say, we don't know what our view is, we're just gonna convene. And I shouldn't say just, because that often is, convening is so important. We're gonna bring people to the table. And so, again, there's so much that you can do, and rather than thinking about it as an either or, do we do advocacy or not, it's really thinking about what makes sense for us, how do we get involved, and recognizing that you are not alone in doing this. One of the reasons that you're part of VFN, that you're here at this conference, is to connect with others, that you're part of a community. And so VFN has lots of resources, the Council on Foundation has lots of resources, other affinity groups that you're a part of, and so don't think that you're in this together. And with that, I am going to turn it over to Brian to really talk about what this means in action for a community foundation.
All right, well, good morning, everyone. Brandy, thanks for the kind intro. I feel like I haven't known Abby for 15 years, but I feel like I've known her for a really long time because I've seen her on a lot of webinars saying exactly what she said, and that was instrumental for us at the community, at the Arlington Community Foundation. So I'll give you a lot of shout outs today, Abby. I don't embarrass you too much. All right, so a little bit of context setting for our advocacy work in Arlington. Arlington, you all maybe have been up there or you live around there. Very expensive place to live. $152,000 a year for a family of four is area median income. We focus particularly on folks at the lowest end of the median income, so it's 30% AMI, that's $45,000 for a family of four. And specifically, that's about 10,000 households in Arlington, 25,000 people, including children. So, like I said, our program focus, our mission is broader, but our program focus is about the affordability crisis, what it takes to live and remain in Arlington when you're a person of modest means. And we view that as a real threat to the economic vitality of the county, economic prosperity. So I'm going to keep saying that 30% AMI, that's sort of our focus area, and that becomes important when we make choices about how we advocate and how we lobby. We use the L word as well. So I want to jump ahead to sort of the kind of most interesting part about this that might be relevant in the way that you do your work. So we ran a guaranteed income pilot where 200 families received $500 a month for 18 months. It ran from 21 to 2023, 2021 to 2023. Not everybody started at the same time, so that's why it took a little longer. We staggered the households. These are all folks at that lowest income level in Arlington. And it wasn't a full randomized controlled trial, but it was we had a participant and comparison group. They completed surveys every 6 months. The surveys were very sort of hands-on, over the phone, with someone that they got to know over time. So it was a little bit more accessible, and our completion rate was a lot higher compared to sending them an email or sending them something in snail mail. Something we're particularly proud of is protection from benefits loss. So as some of you may know, once you start gaining more income at that very low income level, you start to lose benefits, and that you actually end up worse off in many cases if you lose Medicaid or SNAP or any other benefits. We were able to design it in a way where folks were protected from losing those benefits. There's a lot to talk about there. Folks are really interested in that. I'm happy to talk to you more offline, but the short version of it is this pilot was fully privately funded. So we had less rules about public dollars, if you're running one with public dollars. And then we also intentionally, with the randomization pool that we had in collaboration with Arlington County DHS, we were able to identify folks that had benefits that we were not going to be able to protect. So for example, SSI is a benefit we were not going to be able to protect. That means we didn't include folks that had SSI. That was a bummer for me because I've worked in social services. It would be important to support folks on SSI, but just in the way we wanted to design this, we wanted to protect the benefits loss. And finally, we intentionally carved out of the 200 participants, 25 participants who were formerly incarcerated residents of Arlington County who worked with a nonprofit that worked specifically with that, and also 25 were undocumented heads of household. just to better understand the unique challenges faced by those populations and how guaranteed income could support them. I'm going to skip this for time. Ahead of guaranteed income pilot, though, I actually want to talk to you about something we did years ago called Bridges Out of Poverty. It was basically a convening that we brought forth, like Abby was saying, the important role of advocacy includes something like convening. It was a redesign of our safety net system in Arlington using an existing framework called Bridges Out of Poverty. This is something you may be familiar with. So 300 frontline staff and government folks, APS, Arlington Public Schools, got together. So it was this kind of dream scenario of people in cross-disciplinary areas coming together and talking about the ways in which some of these connections don't happen, fall apart, where people kind of fall through the cracks in the system. And it resulted in, again, I just want to give you a sense of what this is in order to talk about advocacy, so don't worry too much about the particulars here. But it resulted in streamlining processes, this universal release form that 38 organizations adopted, and it led to another household level pilot where these organizations worked on specific teams kind of with wraparound services for some households facing the most challenges. So amazing work that we love to do as a convener. We brought these groups together. And what does this have to do with advocacy? Well, it has to do with it when we talk about what did we learn from that process, what did the groups learn, and what do we do with those learnings. So if we talk about the proximate challenge that we were looking at with that initiative, it was siloed services, across government and nonprofits and schools. Many families falling through the cracks. That was the challenge we were trying to tackle. And the response was convening, led by practitioners, and we improved those procedures and outcomes, kind of cut through some bureaucracy. I wasn't a part of the organization at the time, but I'm still proud to talk about the work that we did because that resulted in something really important. But it was sort of what was directly ahead of us, this proximate challenge that these organizations and that the community faced. The structural challenges that you can imagine that we talked about in the room, I didn't know how to put this on a slide, so I just put many. So like this when I say many. So there, affordable housing was a challenge, childcare, all things that we actually did end up doing some pilots on. But one that bubbled to the top felt unique at the time, specific to Arlington, was some work around the benefits split. Families feeling trapped by benefits split, what choices they were making and navigating as they tried to increase their income. So we did some work on raising awareness, bringing attention to that issue. And if you guys have seen those box videos, those little 5-minute videos that explain kind of a complex thing, I love those to help me understand the world. But we did one of those. We did one on public benefits split. It's on our website. I encourage you to. We did it in 2017, and then we refreshed it last year. So that was about raising awareness of the public benefits split. But then what? It felt a little like, what do we do with these structural challenges? How do we address, in a structural way, the challenges that folks are facing? Because we could also work on individual areas like housing and childcare, but it didn't feel like enough. It didn't feel like the advocacy that we had done up until that point was really getting at the crux of some of these issues. So we also knew that advocacy work in our field was not new. There are organizations, some of you maybe have been doing advocacy for years, but we did see an importance to what it would look like to focus on policy change specifically, public investment and policy change, and what levers within advocacy could actually help us get there. So I particularly highlight this report that's from the Center for Effective Philanthropy because it's interviews with foundation leaders across the country, asking them how do you deal with that tension of the work that you're already doing and sort of the broader structural challenges that may require advocacy and, yes, the L word, lobbying. And the biggest thing that you can see from the quote there is that folks actually, especially if you have a large grant making portfolio, which we do not as far as discretionary grant making for advocacy and lobbying, instead, actually I appreciate the chart that you had, Abby, the kind of spectrum on the far right was engaging, kind of working more directly on these issues in a way that nonprofits don't have the capacity or may not have the expertise to do. So that's where we found a lot of momentum and energy. And so going back to 2016 when we were doing that pilot, because we were engaging with safety net organizations, we started to respond to some of the requests that they had around budgets in the county, increasing safety net funding. And so we would sign on to letters and kind of do what I would call sort of one-off initiatives and just being supportive as a good community partner. But then we also started to try to tackle some of those structural issues, particularly in Arlington, around housing affordability and what we call deep affordability at that 30% AMI level, instead of most affordable housing is built at the 60% AMI level, just the way LIHTC credits work. Same thing with childcare. We used some private dollars to launch a pilot to test adoption of subsidies, state-funded subsidies, and what some of the barriers were to that. So, like Abby said, this is all advocacy. This is all work where we're trying to investigate solutions and find innovative approaches. But the question is always, what do you do with that information? I think for us. So we also, in that concern about wages and what folks were dealing with the benefits cliff, we joined this large group called the Guaranteed Income Community of Practice, just to learn a little bit more about how guaranteed income worked and pilots that have run across the country that have been successful. And I'm giving you this narrative because in the background, what we were doing too is, here we go, we were trying to articulate how we would go about this work. We were already engaged in it, but trying to put pen to paper that said, how does the Arlington Community Foundation show up when we engage in advocacy? Or how would we show up if we engage in lobbying, if we think that's important to do? So what I've shared is on your tables in the center, and I think it's face down, but there's a stack of papers, and that's actually what we call our guiding principles of advocacy. If you guys want to grab those, take it with you. And it articulates, again, that how we perceive that we're most effective in this space. And we did this work gradually. It wasn't sort of like we put this together in one meeting, shared it with the board. Instead, it was a longer conversation where we got input from our board members, from past board members, from nonprofits we work for, and that tried to identify how does it feel most effective for the Community Foundation to show up in these conversations. And this is where we really kind of did a deep dive on that due diligence of what advocacy and lobbying really was. And that's where, again, was watching a lot of stuff from Abby Boulder Advocacy at the time, Center for Effective Philanthropy, and also the Council of Foundations has a lot of really good materials on kind of these definitions. So we're doing that self-study kind of internally. Keep going here with the progression. We completed those pilots, and in 2021 we started to share some of those findings. And raising awareness is a key part of it. But we also identified that for us to make good use of these findings, we do have to go and talk to policymakers. We do want to ask them for specific actions. They do involve, in this case, local level legislation. That is lobbying. So we needed to build that capacity as well and do it. So I'm both sort of saying that we're progressing, but I don't want to, kind of to Abby's point, exclude this notion that we were already doing some of the work. We just were trying to formalize the processes around it. Specifically, there is kind of two regimes under which you can do it under IRS rules. One is insubstantial part test, which is just, it gives you a lot less of a structure specifically around how you do it, and that's how we felt comfortable approaching the work early on. But as we move forward, we wanted to formalize a lobbying policy, one that said, here's what's in bounds and out of bounds, and train our staff so that we recognize when the work actually looks like lobbying, when we have to track that and report on it. And that other regime is the 501H election, which is, I forget the name of the name. So it's just a way that you record the hours that you're spending, the resources that you're spending specifically on lobbying. It's not inclusive of everything that you do under advocacy, but it helped us better understand how much work we were doing and that we were coloring within the lines, so to speak. So around this time, you saw we launched the Guaranteed Income Pilot, and so now we're starting to use those findings to advocate for state and federal policy change, and I can tell you a little bit more about that. But the findings are, if you follow Guaranteed Income, are pretty consistent across the state, or across the country, and it really challenges sort of narratives around what people do when they have money in their pocket and if they're of modest means. They work more, they have an opportunity to earn more when they have the flexibility to pay for transportation, to pay for clothing they need for work, to have a little bit more leverage when going and applying to places and choosing which one has better wages. Improve physical and mental health. Our definition of economic mobility is not just the financial components, but it's also the feelings of control over one's life and also feelings of connectedness to community. So our surveys were able to capture those results. So again, we've got good findings. What do we do with them? Well, we're sharing those findings. Again, that raising awareness piece is important. But we are specifically naming the importance of federal policy change and national guaranteed income policy. There's a bill from a congresswoman in New Jersey that would support a federal level pilot run by Treasury for guaranteed income. We are supportive of that. We're advocating for a state level child tax credit. Virginia doesn't have a child tax credit at a state level, so we've joined a coalition. Dr. Advocacy was a part of that as well, to support the child tax credit and putting money in people's pockets. And that narrative work that we mentioned earlier is still really important to us. So we are focused on that and understanding that good things happen when parents have more money to spend for their family, and that enables things like spending more time with their kids. That's what I was really impressed by in our pilot, and in many pilots, not unique to ours, just the importance for kind of family time and how that has important downstream effects to the work that we're all doing to support families. And finally, our broader portfolio that I sort of quickly mentioned, affordable housing and childcare, and we do some wage work, kind of living wage work as well. That's called shared prosperity. But we kind of try and make these connections because it wasn't guaranteed income, in our view, is not sort of a one-off, just like supporting a policy that came out of the blue. The way that you can make trade-offs if you engage in this work is really having a clear sense of what lane that you're in, but also the population that you're serving. And that's where, for us, identifying people at the 30% AMI level has made it easier for us to then say, if some broad initiative comes across our desk that folks want us to spend a lot of resource on or sign on to, we can say no. We can say no if it doesn't align with these existing priorities that our board and our organization has aligned around. So, it's a pleasure to join you today. Thank you.
Thanks for You've heard a lot of information. Do you have questions for our speakers about what they just shared, or other questions they have about advocacy? Yes.
I have a question. I'm really impressed with the momentum that your organization has been able to get. How did you get your board there, or were they there all the way? I was just like,
I thought somebody would ask that. Well, I think part of it, so some of this precedes me, but learning about how we got here, some of it was who's on the board, like our CEO and our team kind of identifying who would be more innovative and open to the ideas like this. So I don't want to downplay the effect of that. I think over time we could identify that some folks were not going to be as supportive just for whatever biases or reasons they have. That's part of it. But I think the other is bringing them along in our own learning around what advocacy is. So that's where I remember, in particular, there was a webinar that Abby ran that we sent out to the board, and just on a whim. And actually, two board members joined, and they were really impressed, and they were like, "Oh, this makes a lot of sense." And that was specifically around that distinction between advocacy and lobbying. And then what I was saying about sort of the language we use and trying to strike this balance of saying we're not starting something new, we're not doing advocacy for the sake of advocacy, but in these issues that we've identified, our portfolio is called shared prosperity, the housing, childcare, wages for folks at 30% AMI. Where could we be most effective? Like what could we do, since we don't have a huge discretionary grant making portfolio? Where could we have the most effect? And I think that's slowly but surely we tried to identify, going and talking to our local county board, identifying where nonprofits don't have the capacity to speak to these issues, or they're nervous to for X, Y, or Z reason. And so we had those individual conversations, and that's where the document I shared with you all was an early idea of how we start to name that language. And the lobbying policy and the more sort of formal process came later. It was, I would say it was sort of a multi-year process to really get our board comfortable with the work we were doing.
multi-year as opposed to multi-decade. That's a whole
Yes, maybe.
I'm just curious, what effect did Amazon have on?
Well, I think some of the
The good and the bad.
The good and the bad. Okay, is this being recorded? No, I'm actually a long-time Arlington resident. I grew up in Arlington, so I think these affordability challenges existed way before
Sure.
some of these large partners arrived. But
Their participation in it.
yeah, but specifically for our advocacy, what was interesting too was that for our childcare pilots, for example, we were able to use some funding from them to test some of these demonstration pilots. So that's the way we frame it, as demonstration pilots then give rise to we determine whether or not there's something to advocate for or what we do with those learnings. So again, for us as a small community foundation, we didn't have a lot of private dollars at first to child care is one of the examples, but the other is guaranteed income. That was kind of a long process to raise those dollars. And in general, what we've done with these partners is whenever we have gotten, so another part of your question that I would speak to is we would sometimes get requests from, I won't say Amazon only, from a few other partners to sign on to some policy or initiative that they're supportive of. If it aligns with our 30% AMI, deeply affordable housing, deeply affordable childcare, and some of our wage work, then we're happy to sign on. If it doesn't, we're happy to point to the policy and say, hey, that's not what our agreed upon priorities are. Yeah, and so the document is much more about how we show up to the county board. So the county board is, we're not going to show up with pitchforks and signs. We're going to talk to folks well in advance, and they're not going to be surprised by our advocacy. But I think with not only with major corporations like that, but I would say even with other nonprofits that they want us to advocate for really worthy causes, I think it's important to be able to say no and to be able to have a consistent reason why.
Yeah, I so appreciate this, especially since it's close to home. And I know there's work happening in DC as well, the same way with some funders. The community foundation complexity that tends to show up when we talk about these issues that are very targeted, that can meet resistance from board members as well as from donors. How have you been able to counter that side and even bring in partners such as some already existing donors and state and local dollars to help support this program?
Yeah, I think some of that is like narrative around what our priorities have been for a long time. So even before we really spoke to advocacy and much less lobbying, the reason I wanted to show you that shared prosperity initiative was what preceded that was this initiative we had called the Nonprofit Center. It was capacity building for nonprofits. So my predecessor just had a long track record of supporting these nonprofits, so she could really bring credibility to say, this is what they want, these are the challenges they're facing. And from there was sort of a natural progression to, well, what are the structural challenges that they can't work on? Affordable housing, affordable childcare, living wage. And so I think the part of the strategy has been really our communications, our messaging around why we're doing that work and doing it in a way, I don't know that we intended to sort of do it slowly. I think we were just trying to, do it well. But then sharing that with donors, sharing that particularly with the ones who were most interested in some of these challenges in Arlington. I mean, I think no matter what your political persuasion is, you know that it's expensive to live in Arlington. The deep affordability crisis is there. So that broader language at the very beginning of our program focus, that was actually somewhat easy to name and bring people along. What I think we're still learning, because this is still a developing area for us, is if some of the challenges, some of the policy, some of the legislation or policy issues become more controversial. I think it's been less controversial, a few things we've worked on, what kind of feedback we're getting from folks around that. And I think so far we've been able to do well. We haven't had any, rogue, like protests or anything. But I think it's always a balancing act, to bring those donors along, because you're going to have people that are, if they're opposed, maybe they just don't pay attention. They're not that worried about what the program side of the community foundation is doing. But it's not because we don't want to share that information. We're not putting it forward.
Yes.
I had a question. So I think one of the, we've always been interested in advocacy, and I'm looking at the worksheet here, and it talks about roadblocks. I think one of the challenges that I look at is not having enough awareness of how, it sounds like the old cartoon back in the old days about the bills and going to Capitol Hill, but like how does that work? Are there playbooks? Because locally I feel like it would be, not to put it in simplistic terms, a little easier to figure out how to push policy or forward, but at the state level, how are policies that you want to try to scale change? How is that done? Are there ways to figure out, navigate that system so that you can get a bill in front of a senator or a delegate, or how does that, that sort of thing? Sort of the higher level state or national level change.
Turn that to Abby.
So, it's a really good question, and I don't know that there is an official playbook, but I would say you're not doing this alone. So I would, encourage you to find partners, and it may be grantees. There's some really good policy organizations in the state that do this work, and they may be focused on your issue, maybe they're not, but to find someone to talk to about that and find out how they've done this. Build relationships with policymakers. So maybe you build a relationship with the state legislators in your region. And when you're starting, you're not going and saying, we want an affordable care bill, or we need to change, broadband access, or we want this or we want that. But really going in and saying, we want to show up for our community in using all the tools we have. Can you help us understand how the legislature works? I'm sure they would love to talk about that. And many of these legislators, they're looking for people to help make their jobs easier. They're looking, for many cases of what they want to do. They need constituents to come and say, yeah, we want you to do this. We have your back. And so building those relationships is really important. Looking for partners who are already doing this. You're not reinventing the wheel. You're not, starting from ground zero, but you can find someone who can help you get in. And there are national organizations, there are state organizations that often track legislation or track issues in particular areas. And so it's finding those policy organizations that, whether it's working on early childhood or working on earned income tax credit, there are often philanthropic affinity groups that are working on that. There are often nonprofit coalitions, but really figuring out who's in the community doing this work. And if you're not sure, reaching out to VFN and saying, do you know who's doing this in the state? Or if not, who's doing this in another state? Often, as we heard at the breakfast plenary, learning and talking to people in other states of what they're doing, or reaching out, or they could connect, or reaching out to the Council on Foundations to find out what's going on. But I would say, don't feel like you have to have all the answers. I'm someone who always wants to sort of be able to do it myself, and recognizing in this kind of work you can't. And it's really going in and saying, this is what we want to accomplish. What advice do you have? How have you done this? What have you learned? What didn't work? And recognizing that to start this is really asking a lot of questions.
Can I add a little just to that? I would say that a lot of our legislators, as polarized as politics seem to be, just really want information.
Yeah.
And so when you reach out to their legislative aid and say, hey, we just love to share and inform you here's what our foundation is working on, here's some of the data behind the need, that is so critical and will really build those relationships very quickly. Legislative aides want to be able to inform the member of the House or the Senate, and so I think that's a really impactful way. And as you noted, there are groups like Voices for Virginia's Children. You may not have an issue that is about children, but they are always willing to train and inform other groups and nonprofits about ways to educate your legislators and become a resource, because that information builds trust, and that trust creates credibility. So I think those are two things. I think foundations have so much amazing information through studies and narratives and through our nonprofits that we partner with. Bring that to the table and you'd be surprised. They are hungry for that because they want to be informed. And sometimes they may even see the light on a position that you.
And I'll just say, it's the question earlier about Amazon. Amazon is not shy about advocating for what they want and don't want. And so it's recognizing that, we need to step up and, we may not have the money, but they, just as we heard with in the session this morning, policymakers don't just want to hear from one side, and they want to make sure they're getting the best information possible, and they don't have time, often to read through 4 zillion different things. And so building those relationships, and as philanthropy, having that, are seen as trusted, credible partners, and so your word can go a long way.
I saw one of the members, and then I'll go after.
For private foundations, can you talk a little bit, I think this is an Abby question, so I'm talking to see Abby, between storytelling, convening, relationship building, and lobbying?
Yeah.
Do they sort of seem on a continuum?
So they often are. I mean, essentially, lobbying is, the law defines, federal law rules for what we can do with private foundations. Essentially defines lobbying in two ways. It's direct lobbying or grassroots lobbying. And direct lobbying is communicating with legislators to express a view about specific legislation. And grassroots lobbying is communicating with the public, so an op-ed, an interview on TV, communicating with the public that expresses a view about specific legislation and has a very specific call to action, where you're encouraging people to reach out to legislators. So you could have storytelling, talking about what issues do you work on, pick an issue that you care about.
Mental health and lack of
So mental
providers.
health and lack of providers. So you could write, do stories, do a lot of communications about the lack of mental health providers and sharing data and sharing information, maybe having a story of, a family, of a school where it's been really disruptive, maybe a workplace where they're having trouble finding workers or what it's mean for their staff who have children who can't get their needs met. So you tell all those stories. Then maybe you start talking about, we need solutions to this, and we can't, grant our way out of this. We can't, our medical schools, our nursing schools can't provide enough providers right away. We need to do something about that. And then start thinking about, okay, well, we need government to change the rules, change the licensing rules, or to maybe change the, provide scholarships, or, do something about the rules about that. All of that can be considered advocacy. It becomes lobbying when you then start reaching out to legislators and saying, we want you to introduce a bill that does X, Y, and Z. Or South Carolina has this bill, we want a bill like that here in Virginia. Or that would be direct lobbying. Or you start writing op-eds where you say, we have a mental health crisis in this state. We need to do something about it. Call your legislators and tell them to support a bill that does X, Y, and Z. That would be lobbying. On the other hand, if you write an op-ed in the paper and you say, we have a mental health crisis in this state, it is time for government to get involved. We need to change the licensing rules about who can provide treatment and who can get reimbursed by Medicare, Medicaid. That by itself is probably not lobbying. And so you can go pretty far in talking about what you think the solution should be before it comes into lobbying.
And we can also fund organizations that are in that space
Yes.
for general ops.
Yep, and so you can also, one of the things that we do, one of the easiest things and the safest thing is, rather than us come out and write the op-ed where we have to be really careful and I look at it and go, we can make a general operating grant to Voices for Virginia's Children and say, you do amazing work, go do it. They could then write the op-ed saying, call your legislators, tell them, and that's great. And so thinking about the different tools that we have, and it may not be the tools that you're used to using, but thinking about all of those tools in your toolbox can actually help you accomplish what you want to do.
That's very helpful.
Yeah, it's a question I was going to follow up on the federal and state engagement. I'm the Maryland Philanthropy Network, so we're like USN, but in Maryland. And so, excellent example that you just gave about building public will and getting into the story on the front end before it becomes a policy, that's excellent. But I want to speak to how you all are already organized and where your power lies is in your PSO, meaning VFN. They are there. They have a policy person, Robin Walken. I hope you said her last name correctly. But that is our structure. Your sector is structured, and you can use your voice in defense of the sector. Donor advised funds legislation, anything else that has to do with the nonprofit sector. We have an umbrella organization, United Philanthropy Forum, and so we have foundations on the Hill, and we would love to see your faces because we are there to say there was this seat at the table act, trying to get a seat or your voices for the philanthropic and the nonprofit sector into, well, to be taken seriously by the federal government, meaning creating an office in the White House, so that there's a more direct connection for the sector. So there are things that you are already organized to do. Another thing in our state, we have a very, very proactive governor. State agencies are showing up at our members' doors like every other day. We've had lots of conversations with them, and it's all about what are your priorities, what are our priorities, how can we work better together, what are the gaps. They're in public-private partnerships, like creating the space for those dialogues and conversations. And then our staff, that's me, I'm the policy person, we're there to kind of connect the dots and make sure that the pieces keep moving. And also, in defense of the sector, making sure that the appropriate asks are coming before our members. And so, anyway, we're very well structured for this work. It's just a matter of tapping into that in strategic ways.
Well, that was a lot, and I hope that you have an appetite for what's to come. I think it's really exciting to think about what's possible when we all work together. I think about regional collaboration, state collaboration, the way that we can advocate for the people that we're trying to serve. Obviously, we didn't get to the questions, but go ahead and take those back with you. Maybe think about this with your staff. Maybe talk to other people here. But thank you. Let me thank Abby and the audience for sharing.